So this is just a brief overview of some of the facts and data that have gone into a series of 5 reports about quality of life in Perth and Huron. The 5 reports are the strong economy, where we talk about topics such as employment and income and the impact on a person's ability to afford essentials like housing, food, energy, transportation. We have Who We Are, which provides information on the people who make up the Perth and Huron region. We have a diverse community. We delve deeply into elements of diversity, such as ethnicity, gender, socioeconomic status, culture, disability. We have a Healthy Wellbeing. It's a big report, prepare yourself. It looks at factors such as physical and mental health, education, safety, the level of community connections, and even how our governments represent us and how those all work towards determining our well-being. And we have a clean environment, which looks into how our quality of life is impacted by forests, rivers, lakes, soil, and the air that we breathe. So throughout our reports, we offer different recommendations, and they can be for different levels of government, community organizations, businesses, and sometimes even individuals. And we hope that these are going to stimulate some conversations and kind of prompt people to think about what actions they could take to enhance the well-being of the community. Pass it over to
Sorry. So the first report we're going to be looking at today is Who We Are, which looks at the demographics of Perth and Huron. So the current median age in Perth is 42.4, and the current median age in Huron is 46.8. Both of these are higher than the provincial median, which is 41.6. In our region, the median age hasn't changed in the last 5 years, and the distribution of the population across broader age categories, like you can see on the slide here, has also not changed significantly. However, by 2032, the proportion of the population that is 65 and older is expected to increase. Here we can see the households in our region. An interesting thing to point out here is that just the proportion of one-person households in both Perth and Huron, so it's 28% in Perth and 29% in Huron. The cost of living is greatly impacted when it's just one person's income that has to cover housing, especially. So that's an interesting point there. 9% of the population in Perth and 7% of the population Huron are immigrants. This is significantly lower than the provincial numbers, which is at 30% of the total Ontario population are immigrants. In Perth and Huron, the majority of immigrants were born in Europe, with the second most being from the US and the third most being from Asia. So in 5 years, the Perth Huron population did grow by 6,822 people, and in the coming 10 years, it is projected to be on a continuing increase. As you can see in the chart here, the increase is more significant for Perth than it is for Huron. The second report we're going to be going into is a diverse community, which looks at the diversity of the population within our region. So over 2,300 individuals in Perth and Huron identify as Indigenous. In Perth, this makes up 1.5% of the population, and in Huron, this is 2% of the population. These numbers are slightly small in comparison to the province as a whole, where almost 3% of the population are Indigenous. Previously referred to as a visible minority, the term racialized population is now more commonly used. According to Statistics Canada, this refers to persons other than Indigenous people who are non-Caucasian in race or non-white in color. So in Perth, 6% of the population is racialized, and in Huron, 2% is racialized in comparison to 34% of Ontario that is racialized. So this chart displays how the racialized populations in our region identify. In Huron, the biggest percentage are people who identify as Black, while in Perth, it is South Asian. It is important to note that we are limited on the data that we can access, and we can't alter the terms that are used here. The data that's presented here is based on Statistic Canada's categories, and the terminology that's used might not best reflect how people actually choose to self-identify. The mother tongue of the majority of people in Perth Huron is either English or French. When asked what language they most often speak at home, 95% said that it was English and 1% said it was French, and the other 4% were split between a variety of languages, such as Indo-European languages and Indo-Iranian languages. So all of the reports, except for who we are accompanied with recommendations. In this report, we have recommendations in relation to newcomer services, such as providing funding for services and newcomer serving organizations. And there are also recommendations that address the need for self-determined resources that provide opportunities for the Indigenous community. Next. In terms of data collection, there have been significant gaps for data for many groups, such as the LGBTQ2S+ community and residents who have a disability. Our recommendations focus on the need for better data collection practices so people are able to better identify with the options that they're given with both national and local data.
Great, I'm just going to pause at this point and ask if there's any questions from anybody in our virtual audience about what we've shared so far. And feel free to unmute and ask. And just further to what Ariba mentioned about data collection practices, as a team, we are going to begin a short-term working group that we're calling the Data Equity Working Group to determine what we can collect and how we can responsibly share information that will demonstrate if there's some systemic inequalities through our organizations and how we can just improve our data practices. So if anybody is interested in joining our data equity working group, which will have its first meeting at the end of January, you can reach out to anybody from the SRPC team, and then we have a contact information at the end of this presentation, or you can just pop it into the chat box. So I'm not seeing any questions. I'm going to move forward on to our next report, which is a Healthy Wellbeing. Don't be intimidated by it. It's a little bit longer than some of our other reports, but it has some really great information. And again, we're talking about physical, mental health, education, government, safety, so many pieces. So first of all, we wanted to share some information that we've received from the 2021 Ontario Student Drug Use and Health Survey. And we're seeing how COVID has really increased the feelings of anxiety and loneliness and some of the other mental health impacts that have been exacerbated by COVID-19. So among youth in Ontario, we see 51% have reported their anxiety increased, and 54% reported their loneliness had increased due to the pandemic. Again, these numbers are Ontario-wide and not specific to Huron Perth, but we have heard from other people who are working regularly with youth that this seems to correlate well to our population here. Efforts to improve overall youth health and well-being go a long way towards minimizing the risk of substance-related harm, which we'll talk about in just a bit. So again, from the same student survey, we see that 30% of youth have reported feeling depressed most days in the last week. 38% felt nervous, anxious, or on edge most days in the last weeks. And interestingly, according to the survey, female students are more likely to report elevated stress and rate their mental health as fair or poor. 42% of students in Ontario report that they wanted to speak to somebody about a mental health problem in the past year, but didn't know who to go to. So that's an opportunity for us to let youth know what's available to them. So in terms of some of the behaviors that we're terming risky behaviors in our report, we see that in Perth and Huron, 10% of youth are currently smokers, and 31% are at high risk to start smoking. Meanwhile, among our local youth, 40 to 24% reported binge drinking in the past month. And in the case of vaping, 26% of youth indicated that they had vaped in the last 30 days. Smoking and alcohol consumption were exacerbated by COVID-19, and we see that youth reported increased use of alcohol and vaping products as a result. So we know that the opioid crisis is impacting Canada, and we're not the only country in the world, and it really is impacting our communities locally. This chart is showing the rate of opioid-related emergency department visits and deaths in Huron and Perth combined. And again, this is the rate per 100,000 of the population, so it's not the actual number. The actual numbers would be higher. We know that this doesn't show the true impact of overdose events in the community because many people aren't seen in an emergency room. And this is because frontline service providers such as EMS, police, firefighters, or even community members are reversing overdose by giving naloxone. This may result in people not being seen in an emergency department. And opioids aren't the only substance that's affecting quality of life for Perth Huron residents. We do know that sedatives and animal tranquilizers are further contaminating the unregulated drug supply and increasing the toxicity of drugs, also leading to deaths in our community. Switching gears here, talk about education levels in our region. We know that education is an important predictor of quality of life, and in general, more highly educated people are healthier, they're more active socially, and usually better paid. Again, those are just general trends. So this graph is showing the highest level of education attained by people between the ages of 25 and 64 in Perth and Huron. So compared to the province, a greater percentage of people in Perth and Huron do not have a high school diploma, and a greater proportion of people who obtain a high school diploma do not pursue further education. The most notable difference from the provincial trends is the smaller proportion of residents with bachelor's degree or higher. We do know that career opportunities and the local workforce demand for skills do align well with training and education in the skilled trades, and you do see this with the non-apprenticeship and apprenticeship certificates and diplomas in our region. Living in safe communities obviously is essential for our well-being, and our personal security is a large component of that. If people feel safe walking in the dark in their neighborhoods and communities, this does reflect the level of personal safety that they feel. In Huron, 80% of people feel safe walking after dark. In Perth, it is 54%, and in Stratford, it is 52%. As well, most people believe that others in their neighborhoods can be trusted. When asked, it was on a sliding scale of 1, cannot be trusted at all, up to 5 can be trusted a lot. Most people chose 3 to 5, so moderate to high levels of trust for people in their neighborhood. And we saw similar results for trust in local merchants and business people too. So trust is high in our region. So according to the 2021 report on discrimination that was produced by the Huron County Immigration Partnership and researched by the University of Western Ontario, and they surveyed experience of discrimination in the past 3 years. And Indigenous peoples were most likely to experience discrimination in Perth and Huron. at 81%. And this was followed by immigrants and visible minorities at 69%. And within the category of immigrants and visible minorities, Black people reported experiencing discrimination more than other ethnicities, and that was at 86%. For comparison, London Middlesex, well, not to compare, but as a comparison to another area, London Middlesex conducted the exact same survey, and it was at a very similar time frame. And their results were lower than Perth and Huron's. In London Middlesex, 62% of Indigenous people reported discrimination. 37% of immigrants and visible minorities reported experiencing discrimination, and it was 44% for the white non-immigrants. And the white non-immigrant category provides a comparison to the populations that we were looking at with this survey. We do have some good data to report, always in our reports, but specifically in the Healthy Wellbeing. So in comparison to Ontario as a whole, people in our region report feeling less stressed. Across all age groups in both Perth and Huron, less than 20% of individuals reported finding life to be quite or extremely stressful. Overall, the majority of Perth Huron residents report that they're either satisfied or very satisfied with their work-life balance. And another positive indicator that we want to share with you is about general life satisfaction. So self-reported life satisfaction is one of the most direct measures of quality of life. And in our region, 97% of people reported being moderately or very satisfied with their lives. So that's a really great statistic to be able to report. We just wanted to choose several of the recommendations that are in the report and talk about them today. We know that providing free drop-in programming is always a good thing. It's removing economic pressures and removes barriers to participation. Recreation is important for overall well-being, and it creates opportunities for social connections within the community. We do know that libraries are important community hubs, and by supporting them and funding them to expand lending programs, which include passes and equipment to access parks and recreational opportunities. It's not just about books. We're ensuring that there's equitable access to resources for everyone. As well, there's a few recommendations regarding training that everyone should be taking part in. The Renfrew recommendations that came out about a year ago with regards to the murder of 3 women in rural Ontario recommend that every single person learn about risk factors and warning signs of intimate partner violence. So there's easily accessible online training. It can be for as little as 1 hour up to a half day, and it provides information on how to support anyone who is concerned about gender-based violence and intimate partner violence. Next. So the best prevention measures often don't have anything to do with substance use. However, we have a variety of recommendations about how to reduce those risky behaviors that we have data on. We know that governments, academics, and health sector should continue studying what public health measures can be done to reduce those risky behaviors. But on the other side of things, restricting or banning products that are disproportionately appealing to youth, such as flavored vape products, can provide another layer of protection. The provincial government funded the development of community safety and well-being plans. However, that funding wasn't extended to the implementation. And community safety and well-being plans are overseen by leadership tables. And at those tables, they're looking at the persistent and complex issues in the community, such as high rates of discrimination, gender-based violence, opioid use, rising mental health challenges. And if these big social issues were provided with dedicated funding to these leadership tables, we know that they could be tackled more effectively. So that's another recommendation we talk about in the report. connected to this, municipal leadership in our region, in partnership with other municipalities and regional community services, with funding, could support the development of a discrimination reporting and referral tool. And this tool could also direct people to community resources and support. So that's another recommendation that we have seen coming out of the report on discrimination produced by the Immigration Partnership. I'm going to pause again here, see if there's any questions. Okay, hearing none, seeing none. We're going to move on to another section, and Will's going to talk to you about some of the economic indicators.
Yeah, so Reba and I are going to tag team this section here, but I've got you for a few slides here. So let's talk a little bit about incomes in Perth Huron, obviously a huge part of our economy here. And so for our 2020 median household income, so this comes from the census in Perth Huron, median income was, or in Perth, the median income was 74,500. In Huron, it was 70K. That's quite a bit lower than the Ontario median income. And this is the after-tax income. So about 9.5K lower for Huron, 5K lower for Perth. And I think one reason we might be concerned about that is when we might think, well, that's okay, but because our region is, a lot more affordable than maybe other parts of the province. And we've got some reason to think that that's not the case. In particular, the living wage calculation for November 2023 was calculated over the past year. And this wage represents a calculation to determine how much any adult full-time wage earner needs to make to afford a pretty basic standard of living. This is not a standard of living where you're putting aside a lot of money for retirement or savings for a house or anything like that, but you're able to afford the basics. So the living wage for November 2023 was calculated at $22.75. And that's the second highest living wage in the province. We're second only to the GTA. So in terms of this overall picture of our region, we've got lower median incomes, but in terms of affordability, the numbers tell us that we're not actually that much more affordable. And as well, for a reference point, that living wage, $22.75 an hour, that's $6 more than the current minimum wage per hour. And the minimum wage is not itself based on a cost of living calculation, although they have been in the last couple of years updating it according to inflation every year, which is a good thing. And of course, the big question is, what can you afford on those incomes in this area? We find that a lot of individuals are living in housing that's unaffordable to them. According to the national standards from the Canadian Mortgage and Housing Corporation, 30% of your income is what you ought to be paying, no more than that, in order for your housing to be considered affordable. So especially for renters in Perth and Huron, 33% in Perth, 31% in Huron are paying more than 30% of their income on shelter costs over the course of a year. And this is especially tough for one-person households or one-earner households. You can see on the right, the median one-adult household is that the median income is $37,000 for a year. Again, that's after-tax income. So for their after-tax income, they'd be spending almost half of their income to afford a pretty basic place or the standard rent in the area. So there's the question of whether housing is affordable to somebody, but you can go forward even further than that and look at sort of a broader definition of housing poverty, and that's we use the term core housing need. So that's when someone's housing is, in the first place, either unaffordable, inadequate, or unsuitable, or some combination of the three. And then secondly, they couldn't afford an alternative in the community. So the median rent of an available apartment is more than 30% of their income. So 14% of tenant households are in that situation in the area. They're in core housing need, which means they're kind of stuck between a rock and a hard place. Their current housing is not where it ought to be, and there's no alternative out there in the community. Fortunately, we do have 15% of tenants, taking advantage of some sort of subsidized housing in our community. That can take a variety of forms. It's sort of any kind of housing made financially accessible to low-income households. So that could be co-op housing, rent geared to income housing. Maybe they're accessing a housing supplement through a municipality or something like that. And I think looking at these numbers next to each other, 14%, 15%, to my mind, I think, we could really afford to double the amount of subsidized housing units available in our community to meet that need, right? Because that's 14% of people whose housing is not working for them right now and don't have an affordable alternative. So, of course, when something goes wrong with someone's housing and they're not able to afford or access an alternative, they might fall into experiencing homelessness. So our municipalities are doing a terrific job of tracking this and really, putting a lot of imagination and effort and coordinating into trying to deal with homelessness. What they've found, in their point in time counts of how many people are experiencing homelessness and their ongoing by name list and acuity evaluations, they've reported that the biggest reasons for homelessness in Perth Huron include things like relationship and family issues, lack of income, mental or physical health related issues. So something going wrong in someone's life, like a relationship deteriorating, they need to find another place. Maybe that's an intimate partner issue. Maybe they lose their job. Maybe that's due to a disability. And again, the question is, can they find something else on whatever income they have? And so that is why we see people falling into homelessness in Perth and Huron, according to the reports we've got. And so a couple numbers for context. I have a point-in-time count number here from 2021 for Huron County, 169 people observed experiencing homelessness at that time. Since then, Huron's implemented a by name list, which means we'll be getting great quality data on homelessness numbers now and going forward. And then in Perth, where they've had a by name list in operation for a while, we saw the median overall number per month in 2022 was 129. Right now, in October 2023, that's the most recent data I have, that's gone up to 153. So there's always a little bit of fluctuation, but right now that number is up from the median in 2022. And of course, housing isn't the only essential that people struggle to afford. It's not the only thing that's gone up in price over the past few years. So we also want to talk about food insecurity in our report. We share some results in our report that are from our food insecurity study. This was a survey we conducted in November 2022 to understand household food insecurity in the region. And food insecurity means not being able to afford enough food or nutritious food, quality food, due to financial constraints in particular. So the study, our study focused on 700 respondents to a survey whose incomes didn't meet all their household needs and who weren't able to access enough food or the right kinds of food due to financial constraints. So this was, again, 700 respondents that met those criteria in our region. And all of those respondents, are marginally food insecure or at risk of food insecure. According to our methodology, 63% of them we could confirm had experienced food insecurity in the past year. And, just for an example of, what that would mean for people, we had 32% of them saying that they were cutting the size of their meals or skipping meals every month. We also had some folks saying they'd had to go a day without food. We had people talking, we heard some things about what people have to eat or have to give up in order to sort of get by. And, we see here 87% of respondents were sacrificing their food budget for other really important things, rent, mortgage, transportation, utilities. These are things you can't really skip on. Another sort of finding that was big for us, 63% of those respondents were employed full time. So that goes back to a couple slides back. Is the minimum wage sufficient for people to meet their needs? And, I think even folks on living wage or, the sort of median wage, it's difficult for them right now in the region. And this is where people are feeling it in their food budgets, their housing budgets. And Reba, I'll pass it off to you for the next slide.
Okay, so jumping to a different topic kind of here. So in both Perth and Huron, the participation rate for men in the labor force is over 10% higher than the participation rate for women. Childcare has been identified as a significant contributing factor for this workforce gap. Women who are working part-time reported that childcare was the biggest reason that they could not work full-time. And even among men, there was an evident participation gap between those that did have children and those that did not. Women are also more likely to work in sectors that were more directly impacted by COVID-19. So during the pandemic, more than 1.6 million women in Canada left the workforce, and the biggest decline in participation rates was for women who had school-aged children. The nonprofit sector contributes almost 8% to Ontario's GDP and employs over 840,000 people. 77% of these are women. And small businesses contribute to the quality of life in many ways. They're reflective of the communities in which that they operate, and they strengthen connections and relationships. They also have a high rate of participation in the community in purchasing goods and services from other local businesses, holding fundraisers, and volunteering at local events. However, both small businesses and the nonprofit sector were significantly impacted by COVID-19. And many nonprofit organizations are still using reserves to continue operations because while demand has significantly increased, their operational funding has not. A running theme in many of this report's recommendations was income. They push for the government to increase minimum wage, for employers to pay a living wage, and for there to be income-based solutions for issues such as food insecurity. Recommendations also advocate for stable long-term operational funding for nonprofits, funding for low-income households as many are experiencing energy poverty, and the development of affordable housing in rural areas. I know there's some questions, but I'm going to quickly go over the last report because it's pretty short, and then we'll go to the questions in the chat. So the last report we're talking about today is A Clean Environment, which focuses on how quality of life is impacted by the environment that is around us. So climate change can lead to warmer temperatures, greater severity of storms, drought, rising ocean levels, extinction of species, and food shortages. Fossil fuels are identified as the biggest contributor to climate change. Globally, they account for over 75% of GHG emissions and 90% of carbon dioxide emissions. The average annual temperatures for Perth and Huron are expected to rise dramatically. You can see in the little thermometer on the side just how much they're going to rise by, and winters are becoming shorter and there are fewer frost days, with a projected decrease of almost 20 frost days in Huron by 2050 and a decrease of 10 frost days in Perth by 2050. The National Greenhouse Gas Reporting Program collects information annually on GHG emissions from facilities that emit 10 kilotons of GHG or more. St. Mary's Cement is the largest emitter in our region, emitting more than 5 times as much as the other 5 Perth Huron facilities combined. Their emissions data for the years that these companies reported on are shown here. The data reported in 2020 and 2021 was affected by COVID-19 related production slowdowns and reduced demand. Other factors affecting emission levels in recent years include lower coal consumption and fuel switching. So the recommendations in this report speak to best practices for protecting land cover and tree cover, reducing greenhouse gas emissions, and adequate recycling and waste disposal.
That concludes kind of the formal part of the presentation, and we can get to some conversations. We're going to stop recording here.